with respect to pulmonary diseases, the emotions involved, anger, that they have a pulmonary disease, and you might remember from our lectures that pulmonary diseases do tend to be progressive and get worse over time, although, that can be a very long period of time. So some people feel very angry about that. They feel very frustrated. They feel very guilty because oftentimes if someone has been a long-time smoker, they feel that they brought this on themselves and, they deserve this. As their pulmonary disease worsens, they may have a dependency on other people. They may feel embarrassed about using medications like inhalers, or using an oxygen tank at some point. People who have asthma, I know it can be related to emotional stress. I mean, hope I've never do this. I've never had anybody have an asthma attack during an exam, but I have heard of people where that has happened. COPD patients often have asthma panic attacks. They may have anxiety. And of course, not surprisingly, as someone goes on with COPD, emphysema, and chronic bronchitis, you do have a fear of death, of suffocation. That is basically what happens when you're not able to breathe anymore. And, when you're not able to breathe, it's very scary. They may be taking many medications. The one good thing about pulmonary rehab, in addition to the physical benefit, is they often get some sort of cognitive behavioral counseling, and that way they can manage their illness and manage some of these, scarier aspects or the guilt or the anger, along with the symptoms of the pulmonary disease itself. Cancer, not surprisingly, people who are recently diagnosed with cancer feel depressed. Their immune system is affected. They're going to have a lot of corticosteroids, not only from the stressful process, but a lot of prednisone and other drugs are going to be used in the treatment. So the good news is there are some studies that show, exercise can help, with depression treatment with cancer patients. But there really hasn't been a whole lot of research on that. That's another emerging area. We do a lot with the physical benefits of exercising cancer, but there hasn't been a whole lot done on the emotional aspects. And that's where, we as exercise scientists can work as part of an interdisciplinary team. And it's not just exercise, and we could have more training in that area, certainly. HIV, AIDS, emotions. So people who have stress and depression will have a faster progression from HIV infection to full-blown AIDS. Not surprisingly, people who have HIV and AIDS are depressed, yet once again, very little trials, again, very little on exercise and AIDS, and much less the emotional aspects that go along with that. Arthritis. A lot of you will be dealing with people with arthritis in your careers as we have an aging population. So people who have rheumatoid arthritis or RA, they tend to be more depressed than people who maybe just have, a bad knee or a bad shoulder, because rheumatoid arthritis exists throughout the entire body. And so it is an inflammatory disease. And so once again, is it the physical symptoms? Is it mental? And, typically people who have rheumatoid arthritis, they might have a very poor quality of life during the flare-ups particularly. So, and also people who are facing joint replacements, even if they have osteoarthritis, it's very scary. It's very emotional. It's obviously a big surgery that they've got to go through. So that is part of, something that they're going to experience if they've got osteoarthritis too. And a lot of people will do anything to try to avoid that eventual joint replacement that they may need.